My name is Alan Seeley. I'm a vestibular physiotherapist, which means that most of the patients I work with are dizzy. And it means I've been working with dizzy clients for many, many years, probably about 16 years now, working with dizzy clients. I have my own practice, so I work entirely in private practice, but I receive referrals from consultants, ear, nose, and throat doctors, neurologists, GPs, general practitioners, and also patients direct to my practice. And I've been teaching these courses for about 10 or 11 years. Vestibular physiotherapy really just means therapy directed at the vestibular condition. So anything that can involve all sorts of different things. Vestibular conditions are very common and involve a number of different causes, and they end or result in a number of different effects for the patient. So the way you approach the patient is key. Now, you can certainly try and stimulate the vestibular system with your therapy. You can aim to restore normal movement, however you like to do that. That will all have a positive effect on the balance system. Ultimately, we're just looking at where is the patient's problem functionally or specifically with regards to movement or activity, and then can we help the patient overcome that? Can we return them to normal function? It can mean many different things to different people. In the recent years, it's come on a lot. It's come on a long way. I think a few years ago, it was very, very patchy. There are some specialist centres where excellence is, where there's a lot of good excellence and knowledge is good, and then there's the vast swathe of most of the population in terms of therapists who know nothing about it. In the English-speaking world, traditionally the USA has kind of led the way. There's some very good centres there. Across the nations, though, there's little good pockets of excellence, for example, in Italy, Germany, Korea now, Scandinavia, particularly Sweden has led the way in the past. It's very patchy, but I think practice is improving now across most of the developed world. As far as the dizzy patient is concerned, it's extremely effective if the intervention is part of a multidisciplinary approach. So the most effective balance clinics are often where the patient will come in and in one session will tend to be seen by perhaps an ear, nose and throat specialist or a therapist or, if necessary, an audiologist in order to take lab tests. The reality for most centres is that we don't have this expertise gathered together. Often, therefore, the therapist is the best person to be the first point of contact. So the therapist is best placed to assess the patient, recognise any red flags, sending the patient where necessary to neurology or for scans, sending the patient if necessary to ear, nose and throat if, for example, there's hearing loss, and requesting, if possible, further laboratory tests. So I think that the physiotherapist or the therapist should be the first contact, and if you like, can almost triage the patient to best help the patient themselves, because most of these patients with dizziness don't need to go and see ear, nose and throat or neurology. They can be managed and treated quite successfully at therapist level. Main factors, I take that to mean as in causes. Dizziness basically just means the brain can't make sense out of the balance information it's getting. The commonest trigger for that is in a rapid onset dizziness is a change to the vestibular signals going into the brain. So typically we'd call that a peripheral vestibular hypofunction or loss, or even possibly stimulus. The commonest cause by far is benign positional vertigo, where you have wee crystals which get out of the otolith into one of the canals, therefore overstimulating one canal on one side in response to head movement and head position. The next commonest would probably be something like a viral neuronitis affecting the function of the nerve between the ear and the brain, thus the brain getting an imbalance of signals causing the brain to perceive that you're spinning when you're not. Another common cause would be a migraine, vestibular migraine. So here, it's an imbalance in the vestibular system, but within the head rather than the ear itself. Finally, we have things such as Meniere's disease, less common by far, where hearing is affected as well as balance. The end result with a lot of these conditions, whatever the trigger, is that you end up with a very sensitive and sensitized central balance system. In that situation, cervical inputs often then become very, very significant, and we will see cervical dizziness. So that's a common cause as well. So vestibular therapy largely will be based upon improving normal function and activity. Now you can do that by helping the brain to reset the system itself. So if there is a vestibular hypofunction, the brain needs to reset that. Now that's where the vestibular therapy, the training comes in place. You can expose the patient to movements and situations and activities which they've been avoiding, and basically they can learn to desensitize to these particular things, so they become less symptom provocative. We can help improve proprioceptive feedback by restoring normal movement throughout the body, but particularly within the neck. If somebody has a problem with dizziness, the natural reaction is to keep the head still, keep the neck still, avoid exacerbating any symptoms. Therefore, neck problems become significant as the proprioceptive changes start to worsen. So anything that restores normal cervical proprioception will help speed up recovery, even if the cause in the first place was within the ear. Ultimately, we're looking at function, so we're just trying to restore normal function, normal movement. However you do that is going to be effective. Generally, there is a great deal of demand for this kind of therapy. Dizziness is incredibly common. It's the most common reason to seek help from your general doctor. So there's an awful lot of dizzy people out there. And by and large, they are not handled very well. They're not treated well. They don't get the right rehab they need, and their conditions become quite chronic. There is a shortage of therapists who know much about dizziness. So if you're looking for a private practice to try and develop a practice, there's a lot of potential for seeing a lot of people and having very good results with these people. The course, as delivered here in Portugal, was a 2-day course where we start off fairly basic in terms of dealing with peripheral vestibular dysfunction. So we concentrate on problems affecting the ear going into the brain. We then will also look at central dysfunctions. On the second day, we look at more complex causes of dizziness, which may be due to pathology within the central vestibular system, or not due to pathology, but due to dysfunctions in the central system, where the brain is struggling to integrate or put together all the different sensory inputs, whether they be vestibular, cervical, or visual. We will talk about cervical dizziness and how we can integrate the cervical dizziness, integrate cervical treatment into our assessment and therapeutic interventions. We look at positional vertigos from the basic typical posterior canal, which is 90% of all positional vertigo problems, right through to the atypical ones. So if you are new to the field of dizziness, you will get the basics, but if you've experienced a lot of dizzy patients before, or you're used to dealing with dizzy patients, then we also progress on to more exciting, innovative and complex ways of dealing with dizziness. The gain is because we should always keep on learning, shouldn't we? I should keep on going on courses myself. We always learn. And as long as we are learning and we have an open mind, we're always likely to improve our own practice. There's a very large number of patients that we see for regular musculoskeletal problems, such as headache and cervical problems, will have underlying vestibular pathology, an imbalance, which is part of the reason for their cervical condition. So what I've found from my practice is, if you have that stubborn headache or neck problem, look for a vestibular lesion underneath. If you can correct the vestibular lesion, suddenly your cervical treatments become a lot more effective. So we have another tool in the toolbox. Also, the courses are fun.
Great.